Can you heal prolapse naturally? That is what we are going to discuss in this video today. And I'm going to cover all the different perspectives of how to heal a prolapse naturally. I'm going to take it from my own perspective, sharing my own story. I am going to talk you through how the healthcare system is approaching it, what the scientific research is actually saying, and also I'm going to give you a few examples of women who have healed prolapse naturally. So now you already know the answer, at least from my perspective. So for those of you who don't know me, my name is Filippa, and I am on my healing journey to heal prolapse and birth injuries and hemorrhoids. So welcome to my channel. I will start to share my own journey. So I had a stage 3, I think, bladder prolapse and also a rectal prolapse that wasn't as bad. The grades can vary a lot. Most of you who have a prolapse already know that, like from day to day, it can vary. So I'm not sure if the grades are very important to talk about. My symptoms, they were horrible. I had depression. I didn't want to get out of bed. I had 2 small kids to take care of. I didn't feel any meaning in my life. I had lost all hope. I thought my life was over by 36, and with 2 small kids, and that just made me even more depressed. I felt no support. I felt super lonely, and the healthcare system, the doctors and midwives I had met, didn't support me at all. They told me, once you have given birth to all the kids you want to have, you can come back and we can do some surgery or something. In the depth of my heart, I knew that's not my way. I don't want to do a surgery in my vagina. It doesn't feel right. I decided to look for other options. I didn't really know what options I was looking for. But I started to, in my research, I found women who had healed their prolapses naturally. So then, everything shifted for me. In my mind, I knew I could do it. And of course, it's been ups and downs and many moments which have been very challenging since then. But like in the core of my being, I knew it was possible all along. I still know. I started to try. I think I tried like 15 methods, 20 methods. In the beginning, I was super focused on the physical activities, the physical exercises, no Kegels. I had already tried that. It didn't work at all for me. But I did, a lot of physical things in terms of hyperpressives, vaginal steaming, diet, and so on. I share it all here on my channel. And then as time went by, I started to notice that my reactions in my daily life and how I felt in my daily life had changed after becoming a mother. I had a lot more stress. I have very high expectations on myself as a mother. I always want to cook very, clean and good food for my kids. I want them to follow the schedule they have and blah, blah, blah. All this causes a lot of stress on me, and I have it, in my home, this stress. So it's not like I never relaxed. So that was a big and important step. Also realizing that from time to time, all these methods that I was trying out to heal became like a list of, check, 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 check. And I was stressed if I didn't get to do all of them. Healing activities or any effort you take to try to heal should not cause stress. Then it will have the opposite effect. I have really, on my journey, I've gone from the more physical. I was also doing a lot of emotional work in the beginning. It was very hands-on because I had panic attacks. So I felt it was so obvious that this is going to create stress for me. So I did implement that in the beginning, but then when the panic attacks slowly started to decrease, I was very focused on the physical parts. Of course, I'm a yoga teacher. I do already a lot of meditation and like breathing exercises, but still, I think my approach was very physical. All the downs in my healing journey have been points where I have to kind of give up and give away my power and just realize that I can't do this on my own. So, for example, if I had had no symptoms for like a month and then suddenly a symptom was back of heaviness or bulging or openness in the vagina, that would like bring me down almost even more than when I had my prolapse. Like I was just so down. I couldn't even connect to that it has actually been so many good days in a row. It was boom, that's gone. This is so bad. It's always going to be like this. Like mentally, it was just everything was bringing me down. And I had this moment where I was just crying and asking for help, to people, but also to like the universe. I felt so powerless. And it was after that I really started to focus on the more spiritual and mental part of healing. I really dedicated myself to do affirmations every day. I have become so much more aware of how I speak to myself and how much the mind is creating my future in words that my mind is using or thoughts that I'm thinking, and that I can actually control them. I am still on the journey. I have implemented a lot of other techniques now where I am more working mentally, emotionally, and spiritually. And I think that is such an important piece when you are healing. I don't have any symptoms of the prolapse anymore. I don't feel limited in my daily life. I do all the activities I want to. So I am sure that you can heal a prolapse naturally. And it doesn't have to do with age or how big your baby was or what birth you had or what kind of trauma you have in your pelvic floor. Everybody can heal. Everyone can heal a prolapse. It might be different roads and journeys to get there, or it is different roads to get there, but you can. If you listen into what your needs are, what your body's needs are, but also like your spiritual self. What is it that your spiritual part of you need? That's my story, and what I've concluded from this is that you really need to get to the root cause of why do you have this prolapse. And this is a big part that the healthcare system is missing, to ask this question: why does Philippa experience a prolapse? Why is it? And if you look at it from that perspective, and you look at the prolapse as a symptom, which it is, and being very clear on not identifying yourself with having a prolapse, then you will start to get signals from the body on what steps you can take to start to decrease this symptom. It's like a crying baby. It's like the baby cries and you are thinking to yourself, is the baby hungry? Does the baby need to change diaper? Or what's the root cause for the crying? And I think it's really important not to, just put in a pacifier in a baby's mouth to stop the crying, but actually change the diaper or give the food. So, and that's the same thing with prolapse. So if you have the symptoms, don't try to just decrease it through a pessary or a surgery, then the root cause will not be addressed. From the healthcare system's perspective, it's more about decreasing the symptom, not going to the root cause. And from my perspective, I think it's like the mistakes starts when a gynecologist, for example, puts a grade on a prolapse. So first of all, as I mentioned in the beginning, the position of the prolapse will change from day to day, even from hour to hour. And you all who are experiencing a prolapse knows this. Secondly, most doctors who give some kind of grade to a prolapse do it while the woman is in a horizontal level. And that's a big, big mistake, because gravity plays a big role in prolapse. And all of you know that too. So that's like two mistakes. And then the third is to actually give a grade and put this imprint in the woman's brain, what grade she has and how horrible this situation is. Or even if it's a grade 1 and she wasn't aware of it, still she's going to have this image of herself and start to identify with the grade, which is actually made up. And especially doctors who have never experienced a prolapse themselves, from my perspective, is not really qualified in expressing any kind of grade or box in a situation for a woman that the doctor cannot relate to. What the healthcare system does really is giving, of course, Kegels, and that might help for, I think, about 1 in 5 women, it can help with Kegels. So that might be a way. They are also recommending pessary and surgery, and both those things are just to decrease the symptoms. It's not going to the root cause. And you will probably have some kind of problem even after doing a surgery, for example. For many women, it takes just a few months and the prolapse is back, or they have a new prolapse, or they have incontinence, and so on. Now I want to share this really inspiring video, or it's just a minute from the video. I'm going to post the link below. This is Dr. Lissa Rankin, and she is doing research on how powerful the mind is on the body, and specifically in regards to healing. And so this is what she is talking about from her own research perspective on if you want to heal, whatever you want to heal. So this is generally about healing.
Whenever we talk about these sorts of things, it's easy for people to kind of make the leap to, well, I've done everything right. I'm still sick. I must be doing something wrong, or I must have caused my illness in some way. And I'm in no way suggesting that anybody who is sick has brought this upon themselves. I'm in no way blaming or shaming or trying to guilt somebody about an illness. It's not about that. All that does is trigger more stress responses. So step 6 is really important, because we have to, at some point, accept that, maybe we're battling an illness because it's our wake-up call. Maybe the illness is something our souls chose to experience in this life so that we can learn what we're here on this earth to learn. Or maybe it's just bad luck. But there's a difference between thinking that you're a helpless victim of an illness and recognizing that your body is your business. So it's a fine line. I was talking to one of my mentors, Dr. Christiane Northrup, about this. And I said, how do I explain this to people without it sound like I'm blaming people for their illness? She said, Lissa, we are responsible to our illness, not for our illness. In other words, your body is your business. And you have at least some power over whether or not your body is going to be optimally vital based on being the gatekeeper of your own mind. So figuring these things out changed how I think about the whole establishment of medicine. And I'm on this mission now to heal healthcare, to put the care back in healthcare. And I realize that one of the biggest reasons that our healthcare system is broken is because we've forgotten we've forgotten about the body's innate ability to heal itself. And we've gotten so invested in technology that we've actually lost touch with one of the most healing things that the body knows how to do. And I firmly believe that if every empowered patient and every conscious healthcare provider started adopting this way of thinking about health, what I call whole health, that it would change our entire system.
Yes, exactly. I just think she really puts word on what I'm trying to say here. I'm going to give you a few examples of this for prolapse. This is one of the first women, Shannon Dunn, that I found who had healed prolapse naturally. And she's been such a guiding light in my own journey. And she healed completely 4 years after giving birth to her first baby. She did it in a very holistic way, working mostly mentally, emotionally, and spiritually. Some physical activities too, but mostly the other parts. And so this is just some reflections from her.
First thing, Kathy, that I always say to women is they are their own guru. It's not about me telling a woman what she needs to do to heal. I can give the guidelines. I can say what worked for me holistically. I can tell women the practitioners I used. I can tell them everything. But their journey is their journey. So it's really important for them to come within, to listen to the body's signals. The body's symptoms, prolapse is a symptom. I always looked at it as a symptom. And so when we listen to our body and we look at it as a symptom, we're then more inclined to follow the steps that are unique to us. So I can certainly give lots of advice to the whole holistic picture, which is really important, but then it's really important for then the woman to go and choose within that what feels right for her. Because this has been the problem with the prolapse industry, is that it's a blanket approach. Kegels, the different machines that they have and things to tighten and tone and whatever. There's no talk about holistically working with a woman where she's at, because even though two women might have the same symptoms, how they arrived at those symptoms would be very different.
Yes, exactly. Shannon has written a couple of books. I'm going to link to her website below as well. I really recommend you to take a look at her journey deeper than this interview. I'm going to link to this interview as well. And then I want to show you here, we have Kimberly Ann Johnson, who have also healed her own prolapse and have helped facilitate the healing of many women's prolapses through scar tissue remediation. And so this is Kimberly, and here she is sharing the story when the healing actually happened, like within a moment.
Some people have prolapse after birth, like this woman that I was talking about. She didn't do any hard impact exercise. It was as a result of her birth that she had this prolapse.
From the pushing.
She felt that it was because she had a full bladder and she was pushing with a full bladder. I think that's a pretty good guess.
Okay.
So she'd had all this physical therapy. She'd been back to the doctor. Everyone was kind of minimizing it, like, we've done as much as we can. It's really not that bad. But she felt that it was from her internal sense. And on our second session, we went back into her birth story. It happened spontaneously. I had my fingers working on the tissue, feeling what was happening in the surrounding musculature. And she had a vision of herself being on the bed in the hospital, but part of herself being on the other side of the room. So kind of a classic dissociative scenario where she's looking at herself from outside and remembering the sound of the instruments that were happening at the time and remembering some of the things that the nurses were saying at that time. And through my somatic experiencing trauma resolution skills, I helped her to bridge that gap in that moment, but in present time, in a feeling of safety in my office, in a place where we had rapport, to be able to bring those parts of herself back together and renegotiate what she thought about herself because that had happened.
And then what happened?
After that session, everything just firmed up and she didn't have any more prolapse after that.
It's mind-blowing. It's like, that doesn't always happen, of course. That would have been an easy quick fix, which natural healing mostly is not. But on the other hand, we don't know what that woman had tried before she came to Kimberly. So maybe she had really done her work, trying other methods. And, natural healing really needs a holistic approach. So we need to try different things all the time. And we can't just settle with one method and think this will be the solution. Nothing is the solution except from starting to listening to ourselves and connect to the present moment and our experience in this moment. So that's a really amazing story as well. And then finally, I wanna just come over here and show you Abby's story. Abby is my hyperpressives teacher, and she has this amazing hyperpressives course on women's cycles. And this is part of her story.
Then I went to do hyperpressives. After the first session, during the first session, I could actually feel, it felt like my prolapse was pulling back up inside. It was the most amazing feeling. It felt like the thing that was obstructing the front, the feeling of the tampon falling out, the heaviness, was just being pulled away from the entrance. It was the most, honestly, transformational feeling. I felt like I could be fixed. I felt like I was broken and I could be fixed. So I practiced loads. And then I went back for another session. And then I went back for another session. And slowly, over the course of, I'd say a year, the prolapse, I'd stop thinking about it all the time.
This is also so amazing. And this is, I think, what Abby is talking about is almost the mental part. So hyperpressives really was had a very big impact on her healing, but also just feeling this sensation that my own body, not my hand, but from within, can lift everything back into place. That means I can do this. And I think my guess would be that played at least 50% of Abby's healing journey. And same was for me. After 3 weeks, I felt improvement after doing hyperpressives. And that mental shift, what I was experiencing, that, it's working, I can do this. But then to be really present and follow any signal that the body is giving you. If it's, rest and sleep for 1 week, 2 weeks, a month, then go ahead and do that. That's what your body needs. If you listen to it and you feel you are tired and need more rest and sleep, then you do that. It's not that you really have to do all these physical things all the time. It's going to shift. It's like women's menstrual cycles. For each week, to help facilitate the hormonal production in the body, we need different things different weeks. Some weeks we need to rest more, and some weeks we can be more active. So it's really about tuning into the female body and facilitate and support the journey to healing, which we all have inside of us. Thank you so much for watching. I really hope you can take away parts from this video and really start to reflect on your own journey. What is it that you need to heal?